Good afternoon. We now have vision, so we'll get underway. Welcome to our afternoon session or our late afternoon session. My name is Anne-Marie Liddy. I'm a Director of Health Consumers Queensland. Welcome to this session. I'd like to start the session by acknowledging the traditional owners of the land on which we're meeting today, the Kabi people, and pay our respects to elders past, present and future leaders. Also acknowledge that for those of us who are joining online, that you're joining us from many places across Queensland, and we acknowledge and pay our respects to the traditional owners and custodians of the lands from which you're joining us. We have two really engaging sessions to come, and first off we're going to hear from Moreton Health on dancing the trust tango in health service and consumer relationships, which I'm assuming is not code for a Dancing with the Stars performance, but something much more complex that we look forward to hearing. I'm going to introduce you to Trisha Hansen from Moreton Health, and Trisha's going to be facilitating our panel this afternoon. Welcome, Trisha.
Thank you so much for the warm welcome, and thank you very much for having us here today as well. We're really excited to be here, and I'd like to start off by introducing the panel. So starting from here, we've got Ryan. So Ryan is one of our clinical nurse consultants for older person services. Next to Ryan, we have Jess, and Jess is one of our physiotherapists in the community-based rehabilitation team. We've got Christopher Hicks, who's our Program Director, Clinical Operational Lead. And then we've got two consumer reps with us today. We've got Kathan Winchester, a consumer rep on many different things, but also one of our Youth Advisory Council members and one of our Consumer and Community Advisory Council members. And we've got Rajini, Eshwarachar, Shankar, who is also a consumer representative on quite a few different committees and projects, but also a consumer and community advisory council member. Our third representative is unfortunately unwell in her room. So she's, Belinda Barrie is an amazing consumer rep as well. She's accesses the health service, but she's also a carer for her mother. And was a carer for her late husband. So she sends her apologies, and we're all thinking of her. I know how much she wanted to be up here with you guys, but we'll make sure that we incorporate some of her comments in our discussion as well. So in true Moreton Health style, we would like to acknowledge the traditional owners of the lands where Moreton Health is based. And for us, it's the Jagera, Yugara and Igurapul people. They're a nation of more than 60,000 years old. And so when we're talking about trust, obviously for our First Nations people, that is such an important topic, and one that we have yet to nut out and look at what does good look like for our First Nations people when we provide healthcare. I would like to acknowledge the elders past, present and emerging. And at Moreton Health, we also do a mental health acknowledgement as well. So those in the room today and attending this forum that could possibly be living with mental illness, and also the carers of those living with mental illness as well. I'd just like to take a moment to set the scene, and the title of today's panel discussion is a little bit strange, and you might be asking why a tango. And I always reflect back on my aunt and uncle who very late in life decided to take up ballroom dancing, and as a smaller person or younger person, reflecting back on watching them dance on the dance floor, I thought to myself, how do they glide so well? You know, are there any ballroom dancers in the room today? No. Oh, excellent. You will know all about the trust tango then. And when I asked my uncle, you know, what's that magic ingredient? What is it that makes you dance and glide so beautifully? They both said it's around that relationship. It's a deep connecting relationship, and it's a trusting relationship. So they trust each partner to make sure they know what they're doing. They have faith and knowledge in knowing what their partner is doing, but also to guide each other in that mutual relationship. And it was really obvious of couples that potentially might be a bit newer, couples that potentially may not be getting along so well. And you could tell that their tango was not as smooth as others. And so part of that inspires the relationship that we would like to talk about today. It is quite a risky topic that we would like to talk about, which is all about you know, at what point do we engage consumers? What are the risks? particularly in something that might still be very sensitive and confidential. And the team here Chris will give you some more context around this particular case study. But then having a bit of a living room style discussion. So it is going to be quite relaxed around what are some of those considerations when this team engaged in the project. So without further ado, I will hand over to Chris, who's just going to provide you some context, and then we'll start the lounge room chat.
Working? Yes. So the genesis of this project was that we had to develop a model of service for a 90-bed facility in providing subacute care at Ripley, which is a suburb about 10 kilometres from Ipswich Hospital. Already at that site, and it's well on the way to construction, is a satellite hospital, one of the 7 satellite hospitals that are being built in southeast Queensland. So the site was thought quite appropriate because we've already got some established health services on board, and to co-locate then a 90-bed subacute facility would be a good idea. So it's part of the Queensland Government's Accelerated Infrastructure Delivery Program, which meant HASTE was the sort of operating word. Capital budget of $85 million for the project, and the services to be provided were rehabilitation, older persons care and palliative care. And so we anticipate that that hospital will be completed by December 2024. So in order to provide a good clinical set of information that would then inform the process of building, we needed to develop a model of service for the facility. And while developing models of service is not unique by any stretch in any health service, this was a bit of a unique project for 2 reasons. The first being is that although we have rural facilities, there are 4 of them in our health service, this was the first time we were actually taking services provided in a traditional, hospital environment and locating them at some distance down the track. So not only did we have to consider services like, the sort of the medical, allied health, nursing components, but also back of house, who's going to clean the place, security, all of those elements, because we're more or less setting up a standalone facility, as it were. And the second one, and this is where the Tango comes into it, was that at the point where we started the model of service development, it wasn't actually announced government policy. So eventually it did become announced, but then there was this kind of, we want to involve consumers. We think that's really important, but we've got to swear them to secrecy. And what does that feel and look like? So it was a little bit complicated from that point of view. So if we can go to the next slide. Sorry, it doesn't recognise me with these glasses on. So this is an illustration of the kind of components to a model of service across the rehab, older persons and palliative care. So of course you've got all the partners, and I won't read them all out, but there are many partners in this, because it wasn't like we're opening a new ward on the hospital, it was we were opening a whole new hospital. The other thing was the relationships that were required to be developed. So across community practice, general practice, the Queensland Ambulance, all of those sorts of folks. We looked at the enablers, the governance, infrastructure, workforce and digital systems. And then we also had to consider what were our KPIs, markers of success. How would we measure that we're running that hospital well from a model of service point of view? So if we go to the next bit. So this is this outlines our planning methodology, which is pretty, it's nothing new under the sun here. And really this section was initiation, diagnostics and solution design. So they were the three phases. Implementation will be when the hospital is commissioned and opened. So that's a whole nother body of work that has to happen. And then of course we need to evaluate how the model of service is working. And again, we won't be able to do that until the place is operating, as it were. So it was really the project was around that initiation, the diagnosis, or the development of the model of service, which was really the solution design in this case. If we can go to the next slide. So again, this tries to illustrate all the various folks that we tried to involve in the process. And what I just wanted to point out there, that inner circle was the project team, which consisted in our case of Jess and myself running the model of service project. We had our allied health team leads and allied health directors, the nurse unit managers and clinical nursing consultants from across the specialties, and ditto for the medical staff as well. But importantly, we had consumer and care representatives involved in that whole, in those processes across those three specialties. The other folks we certainly involved, but we sort of divided and conquered, I guess. So people like fire and security, speech, some of those other folks kind of we did separate. The other thing to understand, so this was from about May to June. So we're still kind of in COVID land. And it was actually the first set of meetings that we set up were one of the first times we'd actually got together to meet in person. And it all had to be still with masks on and all of the guff that goes with that. So it was kind of like, I call it a hybrid model, where some of the consultation was in person, some of it was virtual, and then some of it towards the end in terms of reviewing the documentation was certainly virtual, but also by email. So at least that can provide a bit of context as to what the project was. And we can now talk about how we involved our wonderful consumers in that process.
Fantastic. Thank you so much, Chris. That was a really good overview and providing some context. And of course, what we're really here to do today is to ask some of those really tough questions. And I think as a health service employee, managing and understanding and taking a risk in how early do we engage consumer representatives with some of this really sensitive, confidential stuff. And from a consumer perspective, I hear all the time, why aren't they coming to us first? Why aren't they asking us first before they design all of these amazing models of care? So it's really great to have our 5 people in our living room today. We have a set of prepared questions, and you will be observers at the start to a conversation that's happening in this living room, and then we will open it up to the rest of the floor to you guys if you've got some questions for the panel as well. So I might throw this first one to Chris, particularly because you started managing the project. When should we be engaging? Like, at what point, from your perspective?
Very good question. So I have to claim from the beginning that I had started in master planning about a month before this project started. So my first port of call was to look at what our, how do you do master planning, going through our master plan documents, and also our clinical services strategy, and then looking at some of the Queensland Health documents, which quite unsurprisingly to anybody in this room talked about early consumer engagement. So I guess my reaction was, well, if that's what they say in all of these fancy documents, that's what we've got to do. So I might throw it back to you though, Trish, to describe what our consumer engagement, strategy looks like, because the advantage I think I had is I knew Trisha was the consumer, liaison officer. I think that's your title. And I just thought, oh, well, I'll just talk to her. And can I say that for someone who's working, in master planning, the ability to just get on the phone to someone to then organise all these wonderful people in the way that she did was just simply amazing. But I've become aware since that it's not the norm, and not every HHS has that, has that available to them.
Thank you, Chris. So we're hearing that it needs to start because the documents say that we should be starting, and therefore we start. I'd be really keen, maybe Kathan, to hear from your perspective as a consumer. When do you think that the conversation should start?
Yeah, so I'd say like as early as it can. Like as soon as you find out that that project is happening, like engaging consumers and, building that rapport and that trust with your consumer panel, and really starting to figure out like what are you going to do with like the funding, where are you going to be, like what's the project idea, like where are you wanting to head with this, what is the goal, and really like getting into the nitty gritty with those consumers, and just starting as early as you can, really, I think is the main part that we've all kind of heard a lot of today.
Great. So we're hearing the documents say that we should be starting. We're hearing consumers saying we should be starting as soon as we can. And yet we're working in an environment where we're not meant to be talking to anyone about anything at this stage. And there presents our challenges and responsibilities. So can you maybe talk about what are, from your perspective still, Kathan, what do you think are some of those challenges and responsibilities of being engaged as soon as you can?
I think some of the challenges are definitely around that, like the trust in confidentiality and kind of making sure that everything stays within the project, which can be a bit hard as a consumer, because obviously you want to be able to reach out to your networks and get their perspectives, but when you're at this early stage in development, you can't go and just reach out to all your networks and be like, hey, there's this new project. But in the same thing, I think you still have all that knowledge that you usually would have from those networks, and you still know like all the connections that you have and all the experience and lived experience that you have. So you still know that you have all this knowledge and experience that you can use, and it's still going to make a huge impact on the project. And while it might be a challenge that you can't reach out to those networks, you don't necessarily need them at that point, because it's really only just the beginning of the project, and you know that you're just going to be, dealing with the really important but really early stuff, and getting into what the goals and what the plan is with the project, and just where they should be heading.
Thanks, Kathan. Jess and Ryan, you guys are the clinicians, and I know that sometimes the word clinicians gets thrown around a little bit. I feel as though you were really very vulnerable at this stage, because you were really relying on that Tango to be able to guide you around what does good look like. We have an amazing opportunity to be able to design something great that's really relevant, that provides an amazing service, but makes the staff feel good too. Can you tell us what you think what are some of the thinking around your challenges and responsibilities starting early?
Okay. Is this on? Yeah, it is. Certainly, just to touch on the timing, and it's something that's been spoken a lot about today. I think that early engagement is not something that's always done well. I'm a nurse. I like to solve problems, get them done, move on. And I think a lot of people in health are very much the same. And I think that coming into this project, I knew nothing about it. And to come in at the same point in time as Kathan, Rajini and Belinda, it creates that sense of equality. And I know there's been some themes spoken today about power imbalance, and I think it helps to reduce that power imbalance. If we all come in, we all know as much or as little as each other. So yeah, that timing I think is incredibly important. I think Jess might talk about some of the more practicalities. But yeah, I think also that equality also needs to be tempered with expectation, because we get funding, we get great ideas, and there's that blue sky thinking, and we all get very excited about what it is that we can do, but it's then often very difficult to temper those expectations, and that's for clinicians as well as consumers, I would assume.
Yeah, I would definitely agree with those points there around everyone coming into the room at the same point in time and with the same amount of information. And that's probably, in this case, the pace that the project needed to go at helped that, because we didn't have time to meet with people individually prior. But that also posed a challenge in that it needed to happen very quickly. We needed to get the right people in the room as quickly as we could. As Chris touched on, Trisha's role was able to facilitate that very, very quickly for us, with consumers that were very prepared to jump on board at pace. I think also at the starting point, some of the responsibility, particularly for us as project managers or officers, was making sure that everyone got the information they needed to come to those sessions informed, because it was a short turnaround. The sessions were short. Writing a model of service for 3 different clinical services, you could do that over a very extended period of time. So making sure that what we were able to provide as background was available to all. They're probably the main challenges and responsibilities that I'd touch on.
Yep, that's great. Thank you both. So what we're hearing is well prepared. So maybe having a pre-meeting meeting is what you're saying, Jess, just to make sure everyone's on the same page. And Ryan, you were talking a lot about equality and power imbalance, and it leads in really nicely to our next question, which is about, how do we do this well with a really, rapidly growing population, with the complexity also of diversity of population. And Rajini, I might throw this one to you as a representative of our multicultural community. Can you just tell us a little bit about that from your perspective?
Good afternoon, everyone. Sometimes the words will stuck in my mouth because of language barriers. That's why I write down what I have to say. My name is Rajini Shankar, living in Ipswich. I'm mom of 7-year-old kid and carer for my husband, who is suffering from chronic illness from past 2.5 years. This is my 5th year in Australia, and we are pathway to permanent resident. Basically, I'm from India, linguistically and culturally diverse, non-English speaking background. My initial days was very hard and scareful because it was a new place, new environment, new people, new slang, and new health system, and so on. I got UTI within 3 weeks when I came here. I got 5 miscarriages from past 3 years. My husband got Crohn's disease from past 2.5 years. We are struggling a lot with health and health system. Then we entered to the new system, learned a lot step by step. After that, we come to know through the health literacy as well as guidelines. The service is really good here, but the system has to change. It is very time consuming because we have to wait for long time for the appointments for GP, specialists, as well as procedures, everything that make man more illness turns to chronic. So Westmoreton Health as well as Queensland Health is providing us a good platform to express our problems, feedbacks, suggestions, which gives everyone or every immigrants a ray of hope that someone is there is to help us. Because of this, I'm here as a consumer representative for Westmoreton Health as well as for Queensland Health. I'm also proud to be a voice of my community. Thanks for giving me this opportunity, and thanks for Westmoreton Health and Queensland Health, which is always stands besides us to help.
That's great. Thank you, Rajini. And you've done very well. And what I'm hearing, Rajini, it's really about having a platform and being really inclusive. So making sure that we do have things in place to provide that platform for people. Kathan, I'd be interested in your thoughts on this as well. And I'm conscious of time, and I do want to make sure that we do take questions from the floor as well. Around diversity, what are your thoughts as a consumer rep?
I think we're very lucky in West Moreton that we have quite a diverse group in our consumer reservoir. And like, as myself, like I come from a LGBTQ plus background. I've lived in rural areas. I've lived in urban areas. I have a chronic illness and a disability. So, there's many consumers that are carers. We have consumers that also have chronic illnesses. We have older people. We have younger people. We have such a wide range that I think we're really lucky in that the consumers that we do have a lot of experience and have fit into a lot of diverse backgrounds, communities. So that we do kind of hit that mark that we are reaching the communities and the backgrounds that we need to when we are discussing projects, so that we do have that access to the communities that we need.
Fantastic. Thanks, Kate. And so it's around making sure that we have good representation across the board and lots of it to make sure that there is balance there. What I'd like to do is just merge the next two questions. I'm going to ask our panel members to provide me with 2 words to answer this. So when we're thinking about good engagement in health, and particularly that trust tango that we're dancing today, Ryan, 2 words. What comes to the top of your mind that's most crucial for you?
Equality, diversity.
Oh, that's 2 words.
Can I say timing as well?
Oh, you stuck that one in. Yep, good on you. Thanks, Ryan. Jess?
Open and honest communication.
Oh, that's a good one. That's not always easy, is it? No. Chris?
I can only think of one. Preparation, being well prepared.
Like a tree planner. Kathan?
I just agree on like the diversity and trust.
Yep. Excellent.
I believe in trust.
Trust.
Because
Yeah.
then only we can express ourselves.
Fantastic. Thank you, guys. And so trust is, something that is part of a crucial relationship. And you guys have described the journey really well. Thank you. I would like to take just the next 3 minutes to open up to the floor. Are there any questions that people in the audience may have that you would like to ask the panel? Yeah.
Thank you. That one on? Yep. I'm wondering if you think there is value in engaging consumers before they have the ability to influence things. So if you're engaging before you're really allowed to be talking about things, is it just information out to consumers, or are you already offering space for them to influence the outcomes? And is there value in doing it if there isn't that space?
So I would say in relation to this project, there was absolutely the ability to influence at the beginning. I think that's what defined, why this project was so interesting, is because we had models of care for within the hospital itself for these services, but we had to think outside the square. And so it presented to us a very neat opportunity for real co-design for bringing people in from the beginning. My experience in the past has been consumers have been giving a model of service that's already been designed, and can you just check that we haven't left anything out? And that's just not, in my view, good enough. So this was kind of like, it's new and shiny, so therefore we've got an absolute greenfield opportunity to do what the literature says we should do. So I think there's enormous value in it, and some of the value add included, from Belinda's perspective, the digital enablement of each of the bedrooms so that consumers can have conversations with their clinicians, talk about medication management, because they're actually the ones that know the medications best at the end of the day. And then the other reality we had is some of our clinicians will stay at Ipswich Hospital, so we're looking at sort of virtual models of care delivery in this subacute hospital. So what does that look like? Another example would be part of the model of service is somewhat defining the characteristics of the built environment. That's also subject to another process, you know, the concept design, detailed design, which we're hoping these folks, we can rope them back in for another round as that process unfolds, so that they've not only been involved in the model of service, but in the actual bricks and mortar process as well. So, you know, so again, Belinda's experience in terms of palliative care was enormously helpful in cementing in models of care that you know, building design that the clinicians had already bought, but it moves a conversation from we tentatively think this is good to, with the consumer voice, it actually definitely has to happen.
Thanks, Fritz.
Can I just make a really quick comment on that? I would say definitely yes. And just something I hadn't thought about previously, Joe's answer to a question before about research and involving people, and anybody who was in this room last session, involving consumers before you've even got the research and just getting them to meet people. In the same way, I think that's, yeah, there's a very close comparison there, I would have thought, yeah.
Thanks, Ryan.
Is there time for one more question?
Yeah, I don't believe we've got any questions from online, so
Okay.
we can take one more.
Thank you.
I see in healthcare sometimes we worry about bringing in consumers to these big planning infrastructure projects because we're worried that consumers might expect or want this and we can only deliver this. And I just wondered if that was something that a challenge for your project, perceived or reality, and how you may have managed that in your team.
Clinicians feel the same way.
Yeah, I guess we came in kind of knowing that there was a very early start of the project. And so, you know, having that open and honest communication around that this is the very beginning, and like there may not be a lot of information that they can give us, or that, you know, that we can necessarily change, but that's because we're being involved at the very start, and that is such an accomplishment in itself, that just being appreciated to be involved at the very start, and having all the information that, you know, they have, you know, given to us as well. So it kind of, the expectation was kind of already set at, you know, the same level as everyone else. Is like, okay, this is the start. This is where we're going to be working from. You know, we're going from the ground up. So yeah, I hope that answers your question.
Thank you. Well, I'd like to please join me in thanking the panel for the Tango.